contact the committee staff for assistance. Video of members' participation will be broadcast in the room and via the television/internet feeds. Members participating remotely must seek recognition verbally, and they are asked to mute their microphones when they are not speaking. Members who are participating remotely are reminded to keep the software platform's video function on the entire time they attend the proceeding. Members may leave and rejoin the proceeding. If members depart for a short while for reasons other than joining a different proceeding, they should leave the video function on. If members will be absent for a significant period or depart to join a different proceeding, they should exit the software platform entirely and then rejoin it if they return. Members may use the software platform's chat feature to communicate with staff regarding technical or logistical support issues only. Finally, I have designated a committee staff member to, if necessary, mute unrecognized members' microphones to cancel any inadvertent background noise that may disrupt the proceedings. Well, thank you. We are here this morning to get an update from the Department of Defense on their evolving roles and missions in response to the COVID-19 pandemic. We've had a number of these hearings over the course of the last 9 or 10 months. Very much appreciate the department's cooperation in that process. And this morning we have with us Dr. Robert Salesis, who is performing the duties of Assistant Secretary of Defense for Homeland Defense and Global Security, Major General Jeff Talivar, who is the Vice Director of Operations for the Joint Chiefs, and Major General Stephen Nordhaus, who is the Director of Operations for the National Guard Bureau. Appreciate all of you being here this morning. And for the record, our witnesses are here in person. We have many members who are here virtually. And before we get started, I do want to thank our staff in general, Doug Bush in particular, who's done an outstanding job of making this process work. Hasn't been easy, but I think it has been very, very effective. We've been able to conduct the business of this committee effectively while still accommodating the needs to deal with the COVID pandemic. So it's been a lot of work, and I definitely appreciate that work. I also want to thank the department for their leadership and efforts on the COVID pandemic. There's a number of different layers to this, which we'll want to get into today. Obviously, at the top, is the protection of the force, active duty civilian and guardsmen. How are we able to continue to maintain readiness, maintain performance of the duties, while at the same time protecting our service members from the pandemic and stopping the spread? There's been a lot that DoD has done to make that happen. Learning more about how it is going and how it has gone is enormously helpful, because I think in many ways, Department of Defense has been a leader in some of that, in guiding all of us into how we can get our work done and still contain the virus. So appreciate hearing about that. Also, as we know, the Guard has been called up to help support states and localities in a variety of different ways from the beginning of this pandemic. Most urgently, in some cases, when communities have been overrun, they've set up field hospitals and they've provided staff to meet those needs. I remember in my home state of Washington, which got the sort of first burst in March, we set up a field hospital at a local stadium. Turned out we didn't need it, which was good, but we definitely needed the support staff that was provided, as I know many other states have as well. And now as we go forward, it's going to be really important to see how the Department of Defense can help with the vaccine distribution. And I'd really like to learn this morning more about how you're participating in that, how you're coordinating with FEMA and HHS to maximize the most rapid distribution of the vaccine possible. Also, there are the issues surrounding, production of the vaccine as well. Curious what DoD is working on in that regard. And then lastly, there is the industrial base. Now, the industrial base is enormously important for maintaining our national security needs. They obviously have been stressed in all the ways that the rest of us have in terms of maintaining the workforce, in terms of providing safety for their workers. How is that going? How do we feel about the level of production and making sure that we're meeting our defense needs? And again, while that may start with a focus, certainly from this committee and from the Department of Defense's perspective on, how do we protect defense needs, it has larger implications. Many of these companies obviously do both commercial and defense work. How are they handling that? Are they adequately protecting their workforce? Are they able to meet their needs? If they're not, how are we adjusting to those shortfalls? Many questions to be covered in this conversation and discussion. I look forward to the testimony and to the question and answer. And with that, I will yield to the ranking member, Mr. Rogers, for his opening statement.
Thank you, Mr. Chairman. I appreciate you having this hearing today. Since the earliest days of the pandemic, the U.S. military has been on the front lines of this response, providing critical support to civilian authorities at federal, state, and local levels. The repatriated thousands of Americans, hosted dozens of quarantine testing and vaccination sites, deployed its 2 hospital ships, and set up military field hospitals to surge health care capacity in hard-hit areas, provided thousands of ventilators and millions of respirators and other PPE to civilian authorities, and helped develop the therapeutics and vaccines under Operation Warp Speed that are saving lives and putting an end to this pandemic. For this, we are eternally grateful. And while I know there's a desire to see DoD do more to assist civilian authorities, I'm primarily concerned with its impact that COVID is having on our military readiness. Over the past year, nearly 200 Navy ships have suffered outbreaks, which in some cases disrupted training and operations. Across the services, hundreds of training exercises have been canceled, curtailed, or altered. This is especially problematic for our service members overseas who rely on international exercises to maintain their proficiency. At our shipyards and depots and across the industrial base, COVID workforce reductions are cutting production capacity, delaying maintenance cycles, and pushing planned work back by months. While the services have done a tremendous job to mitigate these impacts and keep our troops on station, I remain worried about the cumulative impact they're having on our readiness. I'm also very concerned with the lack of progress the DoD is making vaccinating our service members. It's my understanding that since the vaccines only received emergency use authorization from the FDA, the DoD is reluctant to make vaccinations mandatory at this time. The department typically waits until full FDA approval before issuing such orders to vaccinate. However, it could be another 2 years before these vaccines receive full FDA approval. With new variants popping up across the globe, I'm not sure we can wait 2 years. It's critical for our national security that every service member, as well as DoD civilian personnel and contractors, receive vaccines as soon as possible. I'm interested to hear from our witnesses what percentage of our service members have been vaccinated, what the refusal rate has been, and what steps are being taken to get more shots into arms. Finally, my job is to ensure our service members have the resources they need to successfully carry out their mission. This pandemic is making that mission much harder. I hope our witnesses will explain what more Congress can do to help the services adapt and overcome. Thank you for being here today, and I thank you, Mr. Chairman, and I yield back.
Thank you, sir. And we'll begin testimony now with Mr. Salasis. You may proceed.
Good morning, Chairman Smith, Ranking Member Rogers, distinguished members of the committee. Thank you for the opportunity to testify before you today on the Department of Defense's response to the COVID-19 pandemic. The COVID-19 pandemic has posed an unprecedented challenge to our nation. Since the start, the DoD has protected its people, supported the national response, ensured the readiness of the force to meet its national security missions. To protect DoD personnel from the pandemic, DoD implemented measures to contain and mitigate the effects on the force, including force health protection guidance, restriction of movement orders, social distancing, mask wearing, telework on an unprecedented scale, and testing and contact tracing. DoD has also established a tiered vaccine plan following CDC guidance tailored to DoD's unique requirements. As of 16 February, DoD has administered approximately 860,000 doses of the vaccine. DoD's support to the national response to the COVID pandemic has evolved over the last 13 months. DoD assistance began in late January 2020, supporting embassies and consulates around the globe to repatriate U.S. citizens and U.S. persons to the United States. In support of the State Department, U.S. Transcom facilitated the safe return of more than 4,500 Americans. In support of HHS, U.S. Northcom and Indo-PACOM and the military departments aided the quarantine of more than 3,000 individuals at 13 military installations. As the pandemic spread over the late winter, early spring of 2020, hospitalizations increased rapidly, and state and local demand rose for both medical facilities and medical providers. HHS and FEMA turned to DoD to help meet this demand. Northcom deployed almost 15,000 DoD personnel, including nearly 5,000 active duty and reserve medical professionals to 10 states and multiple locations within those states. Indo-PACOM provided similar support to Hawaii, Guam, and the Northern Mariana Islands. The Army Corps of Engineers designed and constructed 38 alternate care facilities, providing additional medical bed capacity in multiple states. Working with FEMA, DoD also authorized National Guard personnel to carry out FEMA COVID-19 mission assignments in Title 32 status. More than 47,000 National Guard supported testing, emergency medical care, medical sheltering, public health communications, transportation, logistics, and first responder support. DoD also played a critical role in strengthening the supply chain for medical resources and PPE in short supply. HHS and FEMA leveraged DoD's acquisition logistics expertise to reinforce nearly all facets of the national supply chain. FEMA and HHS established the Supply Chain Task Force in late March of 2020, which was led and heavily supported by DoD experts. The task force accelerated acquisition, expanded production by generating new capacity, and allocated key resources and supplies to priority hotspots around the nation. U.S. Transcom supported Project Airbridge, which also airlifted millions more of critical PPE and medical supplies to fill the supply chain gaps. In late March 2020, DoD also established the COVID Joint Acquisition Task Force to serve as the DoD's nexus for supporting federal acquisition and logistics needs. The GIATF awarded nearly $2 billion worth of contracts to restock the Strategic National Stockpile and expand the domestic industrial base for medical supplies and equipment. The Defense Logistics Agency also executed more than 25,000 contract actions for medical supplies and equipment. Building on decades of work studying infectious disease such as Ebola and the coronaviruses, research and development efforts of DoD experts helped genetically sequence COVID-19 and establish the first treatment protocols for the remdesivir in March of 2020. Furthermore, DARPA-funded projects helped lay the groundwork for rapid development of RNA COVID-19 vaccines produced by Moderna and AstraZeneca. The joint DoD-HHS Vaccine Task Force, established in May of 2020, accelerated the development, the manufacturing, and the distribution of COVID-19 vaccines in record time. Now at approximately 60 million vaccine doses delivered, 42 million which have been administered, and expecting 600 million vaccine regimens delivered by the end of July of 2021. As Secretary Austin made clear in Day 1 message to the Department, DoD must move further and faster to help counter the COVID-19 pandemic. To that end, DoD, with FEMA, has developed plans to support vaccine centers able to administer up to 6,000 vaccines a day. DoD has also supported our allies and partners through the provision of transport of life-saving medical equipment, PPE, and humanitarian aid. DoD has provided more than $200 million in assistance to 143 countries, including testing, diagnostic support, infection control, PPE, and contact tracing, and more. Going forward, DoD is actively implementing President Biden's national strategy, executive orders, and national security policy memorandums, and is committed to executing the President and Secretary Austin's direction to defeat COVID-19 pandemic and defend the force while protecting our nation. Chairman Smith, Ranking Member Rogers, distinguished members of the committee, thank you for the opportunity to testify today. I appreciate the critical role and partnership Congress plays in ensuring the department is prepared to face every challenge at home and abroad.
Thank you. And I should have asked this up front, but are both you gentlemen planning on offering opening statements as well? Okay.
Yes, Chairman. Yes, Chairman.
Then we'll go to General Tolliver.
Thank you, Chairman. Chairman Smith, Ranking Member Rogers, and distinguished members of the committee, Thanks for the opportunity to talk about DoD operations in response to the pandemic today. The Joint Force has been committed to supporting the national COVID response effort from its beginning in early 2020 and has responded to 374 FEMA mission assignments, 47 requests for assistance from other departments and agencies, with many more expected. In the early days of this effort, DoD provided facilities to house personnel evacuated from overseas, and in March of 2020 began providing support to the states through FEMA mission assignments. The capabilities needed by FEMA and the states evolved over time, but included everything from direct medical support to hospitals and nursing facilities, to the deployment of field hospitals and hospital ships, to the staffing of alternate care facilities, mortuary affairs, transportation, and sustainment. As the states and medical community learned more about treating the disease and responding to the pandemic, our primary operational headquarters, U.S. Northern Command, innovated and evolved its response to best meet the needs of our partners. In our initial response, we deployed traditional military capabilities like field hospitals and hospital ships. But over time, it became clear our capabilities could be much more effective augmenting existing hospitals with medical personnel, specifically doctors, nurses, and respiratory therapists. This model met the patients and hospitals where they wanted to be, in the treatment facilities they were used to, and enabled those facilities to handle the increased patient load. Over the past year, U.S. Northern Command has put more than 15,000 Title X forces in the homeland in support of COVID-19 response efforts, including at its peak over 45,000 medical professionals. They've supported 63 different hospitals, 9 alternate care facilities across the country, and today have over 200 personnel supporting 9 hospitals in Arizona, the Navajo Nation, and Texas. U.S. Transportation Command has also moved over 900,000 pounds of supplies, helped repatriate over 4,000 American citizens using military or commercially contracted aircraft. As the nation's response evolves again towards a focus on vaccine distribution, the Joint Force is equally committed. Today, we're already supporting 2 vaccination distribution centers, one in California and one in New Jersey, and have ordered over 4,000 additional forces to prepare to deploy to support the first 25 different centers as needed. We're anticipating FEMA mission assignments that could come quickly for New York, Texas, and elsewhere, and will stay in lockstep with FEMA as the lead federal agency for this effort. The DoD vaccination teams utilize some of the same capabilities from our medical facility support, but also lean more heavily on medics, pharmacists, and more nurses. These teams come in a variety of scalable sizes based on the need of the states. Just as last year, we'll stay agile and continue to innovate and evolve this response as we learn more or the needs of the states change. Thanks for the opportunity to share our experience today and for the work of the committee to support our efforts and our service members over the last year. We look forward to continuing to work with the committee on these important issues going forward. Thank you.
Thank you. General Nordhaus.
Chairman Smith, Ranking Member Rogers, distinguished members of the Armed Service Committee, it is truly an honor to testify before you today on the National Guard's support to COVID-19 and defeating it. I'd like to start by highlighting the historic efforts of our National Guard members in our 50 states, 3 territories in the District of Columbia. These are the same National Guard men and women who spent over 10 million days in 2020 serving their communities and their nation, both domestically and around the world, 4 times more than in the previous year. They helped battle wildfires that damaged over 9.5 million acres. Over 43,100 service members helped maintain order in 34 states, territories in the District of Columbia last summer, when civil disturbances threatened the public's ability to safely protest. And they saved lives and expedited recovery efforts after a record-breaking hurricane season, including 12 named storms impacting the United States. As you know, the National Guard's primary focus within the homeland has been supporting COVID-19 operations. We currently have over 28,400 soldiers and airmen dedicated to COVID-19 operations across all 54 states, territories, and the District of Columbia, performing a wide range of missions. In 2020 alone, our National Guard members tested nearly 13 million people, provided medical planning support to local communities, and conducted warehouse operations to support the distribution of personal protective equipment and medical equipment to hospitals and community medical centers. The National Guard also provided nearly 550 million meals to families in need, disinfected over 9,600 long-term care facilities, and delivered nearly 37 million masks for frontline workers. General Hokanson, Chief of the National Guard Bureau, has made maximum support to COVID vaccination efforts his #1 priority. Since early January, the National Guard has grown from a few civilian vaccination sites to over 350 across 42 states and territories. 33 states and territories are employing National Guard service members to vaccinate citizens. And 9 states provide wraparound services and support to local vaccine centers. As I speak, Army and Air National Guard members are administering, on average, over 72,000 vaccines a day to local citizens. We estimate that since the beginning of our vaccination efforts, the National Guard has administered over 1.2 million vaccinations to our civilian population. Also, vaccinating our National Guard members and their families and our civilians remains a top priority. To date, over 71,000 have received at least their first vaccination, and that number continues to climb today. Next, I would like to highlight to the committee the significant use of the Dual Status Command in efforts to fight the virus. In the aftermath of Hurricane Katrina in 2005, the Dual Status Command concept gained acceptance and allowed a National Guard officer to command both federal and state service members responding to a domestic emergency. Thanks to Congress making the Dual Status Commander a matter of law in the 2012 NDAA, governors are enabled to provide seamless command and control of National Guard, active duty, and reserve service members fighting wildfires, hurricanes, and of course, this virus. During the peak of our response in May, we had 47,400 service members supporting COVID operations, with 41 dual status commanders approved, of which 9 were activated for command and control of active duty and reserve service members within their state or territory. Today, there are currently 21 approved dual status commanders, with 2 activated in California and Texas. Your continued investment in the readiness of the National Guard has paid dividends both on the battlefield and in our communities. Not since World War II has our National Guard been called upon to serve in such numbers. Last June, we had over 120,000 service members supporting missions in our homeland and overseas. Every day, we are reminded of the sacrifices of these brave men and women and their families, and it is with those sacrifices in mind that we remember the 8 National Guard members who died as a result of COVID-19. These soldiers and airmen, while not serving on the front lines of COVID operations, still gave their full devotion to our nation. Their legacy of service will live on in our memories. In closing, I want to thank you for this opportunity to tell the National Guard story. On behalf of over 443,000 National Guard soldiers and airmen, I want to express our gratitude to you for your consistent and unwavering support. We are especially grateful for Congress's support of the Tricare Transitional Assistant Management Program, known as TAMP, which provides 180 days of premium-free transitional health care benefits after regular Tricare benefits end. This protection is crucial to our transitioning National Guard warriors as they demobilize and return to civilian life. We will remain laser-focused with our interagency partners, civilian and military leaders, and frontline workers to help vaccinate our citizens and defeat COVID-19. Every day, tens of thousands of National Guard members, many of whom left their families and jobs, serve on the front lines of this battle, saving lives and minimizing suffering across the nation. The National Guard remains always ready and always there. I look forward to your questions.
Thank you very much. Mr. Rogers alluded to this in his opening statement. What is the plan for vaccinating the DoD workforce? And that's active duty, civilian, Guard, Reserve. How are you implementing that, and particularly in light of the comment Mr. Rogers made about not being able to actually mandate it? Could you pull the microphone just a little closer to you there? There we go.
Chairman, the department has developed a vaccine
Yeah. Yeah, you can speak up.
Adam, we can't hear him.
Yeah.
We can't, sorry, on screen, folks can't hear him.
Okay.
Yeah, we're having a hard time hearing him in here as well. We're sure the microphone's on?
Can you hear me now?
Yeah, it was off. That was
Okay,
the
there you
problem.
go.
So
Well,
there we go.
That's the key to success,
Thanks.
I guess.
So,
today.
yeah, so the key part, and I know the whole, you're going to tier, you're going to do all that.
Right.
What's your estimate on when, how soon you'll get the entire force vaccinated? Are you having problems with members saying, hey, I don't want it? What's your guess on when you can get basically all of your personnel vaccinated?
So just a little bit more perspective. This past week, we vaccinated 170,000 members. It includes both military members, civilians, and contract folks, and obviously beneficiaries, 170,000. In this tiered approach, again, we're focused on the frontline folks that need the vaccine to care for others. Then we move through that process, making sure that we're focused on specific high important mission areas like strategic forces. Then we move through that to the most vulnerable, ages 65 and above, and operational forces. As we move through those tiers 1, 2, they're segmented in a certain way to get after everybody. The bottom line, your question relative to when do we think we'll have everybody vaccinated, it'll probably be sometime in late July, August timeframe. We're making great progress. As you know, the vaccine delivery has picked up significantly. I mean, the vaccine delivery for the country this past week was 13 million doses. So it's picking up exponentially.
Yeah, and that leads me to my second question. In terms of the distribution chain, and I know you guys are certainly focused on, DoD personnel and those folks, but you're also involved in speeding up the chain. And look, it's simple to explain. You need to produce the vaccine, and then you need to get it out to people.
Yes.
But there are, a lot of details in that. So as you're looking at the distribution chain, is there, how to ask this question? But I've seen the reports that basically once we get to July, that's when we're going to get there. What's the most important thing that DoD can do to speed that up? Where do you think you can be helpful? Where are the bottlenecks here? Is it just we don't have enough of it? Is it's not getting distributed to the states? Once it gets to the states, it's not getting out fast enough? Or are we pretty much doing the best we can right now?
My sense is that we can do better, but we're doing a lot to make it happen. If I could give you a bit of a perspective, and I can talk specifically about what the Defense Department is doing. Obviously, the Defense Department is working very closely with FEMA to establish these mega and large centers. That will be very helpful. In fact, I visited the center in Glendale, Arizona about 2 weeks ago. They're providing 8,000 shots a day at a drive-through center out there. That's a tremendous amount of vaccine shots in one day in that area. Our mega centers that we're working with FEMA on will also be able to provide up to 6,000 vaccine shots. The one is just established in Los Angeles. We have plans to establish them in Texas and New York over the coming days, and that will be very helpful. But as you know, if I could just back up, because the vaccine, Pfizer and Moderna right now, we expect 100 million doses by the end of March of each one of those. We expect another 100 million doses from Pfizer and Moderna by the end of May, and another 100 million doses by the end of July. That gives you some perspective of what the supply side is. On the distribution side, the Defense Department is obviously helping with these mega and large centers. At the same time, there's about 30,000 centers identified across the nation with state and local authorities. As the vaccine becomes more readily available, it will be becoming obviously in greater quantities. As I just pointed out, yesterday we did 1.6 million doses in arms around the country.
And that all sounds good, and I apologize for a lot of other members here are going to want to get in. Just quickly, is there a particular choke point where you're like, here's what we need to do, I've seen this, we really need to get after this, or is it just sort of all kind of moving forward as you described?
Sir, I believe it's all moving forward and it's beginning to ramp up much faster than what we've seen. Again, this started December 14th when we started to take the first doses. I think you're going to see a great acceleration over the next 30, 60, 90, 120 days to where at the end of July, we have delivered over 600 million doses of vaccine.
Good, thank you very much, I appreciate it. Mr. Rogers.
Thank you, Mr. Chairman. To follow up on that line of questioning with the chairman, has it been a lack of supply that's held you up from vaccinating more members of the service?
I think in general yes, sir, that's reasonable. I mean, it had not been produced obviously we have hundreds of millions of people to vaccinate. If we focus just on DoD, our increase in supply has been growing every week.
Okay. Well, I was looking at your joint staff COVID-19 update of February 17th, and I see that between first dose and second dose, y'all have administered right at 916,000 doses. And this would be, I guess, for General Tolliver. I thought I heard you testify that there was 860,000. So what's the delta there?
Yeah, Ranking Member, I think that's just the time lag between preparation of the remarks and the products today. There are a lot happening each day. So as of today, 916,575.
Okay, do we know how many of those are for service members as opposed to like depot workers, civilian personnel?
The majority, Ranking Member, are focused on the higher tiered members, Tier 1A and 1B, which are primarily our healthcare workers, critical personnel, so more heavily focused in those areas.
Okay. My understanding, this puts us at about 20% of the individuals we're trying to vaccinate. Is that about right?
Yes. Go ahead.
And that's including civilian personnel and contractors, et cetera.
Correct.
That's correct.
Do we know how many service members have received the vaccine of that 916,000?
Sir, I do have the numbers. What I show, and again, these numbers obviously, depending on when they're captured, either yesterday or today, I show 359,000 initial doses for service members. And then fully vaccinated, that means 2 shots, obviously, 147,000. I also have the civilian numbers and the contract numbers, if you'd like those, sir.
Okay. What about concerns? Have you heard many concerns from service members about apprehensions in taking the vaccine? And if so, what are those concerns and how are y'all managing them?
Yeah.
So, Ranking Member, I think we believe that, of course, the vaccine is the right thing to do. It's clearly safe for service members, and we need to continue to educate our force and help them understand the benefits and ensure there's leadership involvement in the discussion of the benefits of the vaccine.
So do you have a handle, General Tolliver, as what percentage of the service members have declined?
And so, Ranking Member, I think our initial look, and this is of course very early data, is acceptance rates are somewhere in the 2/3 territory, and of course it varies by different groups.
Okay. What about, are they deployable? If somebody who's not vaccinated, is that individual deployable?
So, Ranking Member, the services and the commands have worked very hard over the last year to make sure that we can operate in a COVID environment. Before vaccines were available, the addition of the vaccine should make us more capable in that environment. But we've already demonstrated over the last year that we're fully capable of operating in a COVID environment.
So I take that to mean, yes, they're deployable even if they have not been vaccinated.
Yes, sir.
Great. Finally, what is the current state of readiness across the services when it comes to COVID, and how has it been impacted by COVID?
So, Ranking Member, I think the services have been very adaptive and resilient, that when larger formation exercises weren't possible, they've substituted those with some smaller formations that have allowed them to maintain their basic proficiency and currency and combat readiness. At the same time, of course, there is some quality lost in those larger formation training and exercises, but I would say the overall C ratings or readiness ratings for all the services and combatant commands have stayed within historic norms, largely because of the adaptive and aggressive action by the services and the combatant commands.
Okay, thank you, Mr. Chairman. I yield back.
Thank you. Mr. Langevin.
Thank you, Mr. Chair. Am I coming across okay?
Yeah,
Yep, we got you loud and clear.
Very good. Thank you. I want to thank our witnesses for your testimony today. Let me begin sort of on a follow-up to the ranking member's question. I'm concerned about and focused on readiness as well. So we've seen, obviously, COVID-19 outbreaks disrupt our military's operations, especially Navy deployments. And while the department is doing well in distributing the vaccine it has on hand, last week Secretary Austin said that the department does not know how many service members have declined to get vaccinated. General Nordhaus, what would be the force readiness impacts if fewer than 50 or 60% of service members accept vaccinations? And just for the record, I would assume, but I don't want to assume, I want to be this for the record, do service members have the right to refuse to get vaccinated? It's obviously that impacts readiness. So if you could address both those aspects of the question.
Congressman, thank you for the question. Yes, it's voluntary to receive the vaccination. As far as numbers that we're seeing in the National Guard, it's just like General Tolliver talked about, very similar to what's out in the population, in the 2/3 to 70%. Readiness impacts, if they were lower than the 30 to 40%, as you discussed, I can't really speak to. We've been able to operate within the COVID environment. Like Major General Tolliver talked about, the individual capability of our adjutants general and how they've worked with flexibility and adaptable to make sure that our service members have one way or another gotten the training they need to be ready and to deploy. They've been very successful at that. And to this date, we're able to meet all current and future projected deployments for the National Guard.
Thank you, General. Mr. Salasis, the Biden administration modified the cost share agreement to fully fund the National Guard in Title 32 status at 100% and extended the authorization until September 31st, 2021. What criteria will the department use when determining whether or not to recommend any further extension of funding the National Guard in Title 32 status after September 31st, 2021?
Congressman, thanks for the question. We're working closely with FEMA. Obviously, the National Guard is filling FEMA mission requirements in support of FEMA. And so as we work through this together, we'll make a determination as we get closer to September on whether the continuing efforts of the National Guard obviously is necessary. And if that is the case, obviously we would be supporting 100% reimbursement going forward for that too.
Thank you. And I understand that the department is responsible for obviously supporting civilian efforts for vaccine distribution and tracking. Mr. Salasis, can those responsibilities be taken over by large companies like Amazon, for example, who are experienced in last mile delivery? What would be best in terms of actually function of how do we, get this out? Is it the best in the National Guard, or should we be looking at the private sector like Amazon?
So, Congressman, if we're talking about distribution from the manufacturers, that is being done right now by FedEx and UPS and those kinds of organizations to the state level. And they're maximizing the commercial capability to do that. Is that helpful, Congressman?
So give me take it from there what the National Guard is doing versus what the private sector is then doing.
So once the vaccine has arrived at a distribution point within the state, then the state, obviously the public health and emergency management, state officials take over from there as far as making sure that the right resources at that distribution point and at that vaccination point are available. And I think that's where the National Guard has been tremendously helpful throughout the states with all of the ability to inoculate the citizens in support of their public health and individuals at the state level. But I'll defer to General Nordhaus if he wants to add to how the National Guard is exercising that in the states.
He's going to have to do that in 8 seconds. So why don't we take that for the record, because I think the time's pretty much up. But thank you, appreciate that. And next up is Mr. Turner, recognized for 5 minutes.
Thank you, Mr. Chairman. I want to thank all of our witnesses today. DoD certainly has been extraordinary in its response in what has been an unbelievably difficult situation for our country, and it has been essential. General Nordhaus, I have a couple questions about the National Guard. The Secretary mentioned that we're trying to prioritize the vaccine for those service members who are on the front lines, if you will, or performing functions which are not only essential, but in which they might have exposure. Are the members of the Guard being appropriately prioritized who are, as you indicated, serving their communities in the COVID response, such as serving in food banks, serving in vaccine supply, assisting their communities in ways in which they're backfilling as part of the COVID response? Are they being appropriately prioritized?
Congressman, thanks for the question, and I do have to state that I'm an Ohio Guardsman. First of all, yes, we are in lockstep. We've been fully integrated in the DoD priority schema for the vaccination. We receive our allotment of vaccines, and then we follow right down the list from 1A through 1C. And in that top list of in the 1A are our guardsmen that are serving in COVID operations across the 54, and so they have the ability to get the vaccine, and we've been pushing it out weekly to the states so that they can get vaccinated.
Excellent. General, I have one more follow-up with you, and since both of us have our roots in Ohio, I do want to say that this question is based on information I have actually in other states besides Ohio. Could you please tell me, how is the chain of command working when National Guard work with community partners and are embedded in, for example, food banks, supply systems, or vaccine supplies, where there are community organizations that are actually conducting it? If a service member has concerns about how it's being operated, or even has recommendations, how does that work with respect to their participation? Because they're not just obviously labor; they have great intellectual capability. How are we able to ensure that that's leveraged and that that their thoughts and concerns are taken into consideration?
Congressman, across the 54, from the beginning of this, we've been focused on the federally supported, locally managed. And that has been a great opportunity for our guardsmen as they're out and able to assist at the local level to help local communities be able to expedite, whether it's food banks or vaccines, to those in need. I'll give you, for instance, this is a quote from the Louisiana Director of Community Outreach of Testing and Vaccination Programs, and he talks about that the Louisiana National Guard have been very helpful in assisting them with logistics of all the sites within Louisiana, all the traffic control, and they're helping getting patients registered and really keeping things safe, orderly, and moving properly and efficiently. And so because our guardsmen are traditional and they have civilian jobs all across the different entities, they bring those different perspectives and thoughts to every mission set that they go to. So in South Carolina, Major General McCarty talks about how those guardsmen are able to come up with creative solutions to help solve complex problems. And so every state is working with their interagency partners, whether it's FEMA or whether it's the state health department or whether it's the local community, to make sure that we can support them as best as possible.
Excellent. Thank you, General. Thank you, Chairman. I appreciate you holding this hearing.
Thank you, Mr. Turner. Mr. Courtney, are you participating? Apparently you're not on, so that would be my turn. This will be a question well, first for all of you. It's been an extraordinary year, and clearly the U.S. military, all across all of the services, has been a very, very important part of the American response to the pandemic. And I thank you. This morning as I drove into the Rayburn building, I had the pleasure of seeing National Guardsmen here at the Capitol protecting us and doing so all across the nation. Yesterday, the Readiness Subcommittee did a briefing to learn from the 5 services the impact on readiness. I will just not go through all of that and ask you gentlemen to go through it again. However, I will put it this way, the services have been very creative in addressing the issues and learning along the way. If we knew at the beginning what we know today, the impacts across the military would be significantly less. Nevertheless, learning has taken place. There are concerns, and we'll go into those concerns in more detail in the subcommittee work. But my question really goes to the future here. The new administration wants to use the military, particularly the Defense Production Act. And Mr. Solisses, if you could take this issue up, what is taking place with regard to the Defense Production Act? We're thinking PPEs here, perhaps even the issue of vaccinations being produced and distributed. So if you could talk generally and then perhaps specifically about some examples of where the Defense Production Act is or is not in operation.
Congressman, thank you. I'm going to ask Brent Ingraham, who's with A&S, he actually oversees the Defense Production Act, and he's going to speak to that. Brent?
Good morning, Congressman. From the Defense Industrial Act,
You could bring your chair up and have at it. Please introduce yourself for the record.
good morning. For the record, I'm Mr. Brent Ingraham, Department of Defense Acquisition and Sustainment.
Thank you.
From the Defense and Production Act perspective, the department has used some of our own resources along with supporting both Health and Human Services and FEMA to execute a number of onshoring of medical resources for the need of COVID across both PPE, testing and diagnostics, pharmaceuticals, N95 masks. So to date, the department has awarded about $885 million in Defense Production Act dollars of our own that has been both towards medical resources in the defense industrial base. And then about $1.6 billion on behalf of HHS. So we have done medical investments to include $250 million in N95 respirator masks, $10 million in surgical masks to get the production of over 45 million units per month, $22 million in glove production for over 38 million units a month, and over $880 million in COVID test production kits to get over 86 million units per month.
Are you able to, does the Defense Production Act allow for the prioritization of both the purchases and then the distribution? In 2020, it was principally left up to the states to try to acquire the necessary equipment, PPEs, and others. Are you now using the Defense Production Act to coordinate and to acquire and then distribute necessary equipment, PPEs, for example?
So we use Defense Production Act to acquire material. I'll say Department of Health and Human Services using the Strategic National Stockpile and FEMA are the ones that are actually distributing that PPE to the states and using their rating systems to be able to prioritize for the states.
So there remains across the nation a shortage of equipment. And you're relying, it is the Department of Health and Human Services and FEMA that are setting the pace, and then you administer from there?
We supply them the products, right? So we are doing from an assisted acquisition, providing the contractual and acquisition support to procure the items and stand up the industrial base to be able to produce to their requirements.
Okay. My time having expired, I want to go into this in more depth, and we'll have some written questions for you about how the Defense Production Acts worked. I will now yield and call on Ms. Hartzler. You're up next.
Thank you, Mr. Garamendi, and appreciate everyone here and all that you're doing for our country. I wanted to just follow up on what my colleague just asked about. Even before the pandemic, Representative Garamendi and I had introduced a bill to bring back pharmaceutical production to America because of the vulnerabilities that we had discovered with China being a major source of our pharmaceutical ingredients. And I've been pleased that in January of this year, the Department of Defense, in coordination with HHS, awarded a $69.3 million contract to Continuous Pharmaceuticals to develop a domestic production capability for critical active pharmaceutical ingredients and final dosage from medicines using a proprietary integrated continuous manufacturing technology. And last September, DoD and HHS also signed a $20 million contract with On-Demand Pharmaceuticals to develop a domestic production capability for critical active pharmaceutical ingredients. And so my question is, what capability has been provided here in the United States for standing up our pharmaceuticals, and what additional work is the Department of Defense doing to secure the medical supply chain for our troops through the use of the Defense Production Act? And are there any additional authorities with the Department of Defense that you need for Congress to help with in this effort? So can you kind of expand a little bit on the pharmaceutical production that has been stood up through the Defense Production Act and give us an update on that?
Thank you, Congresswoman. I would like to take that action for the record. We provided both of those capabilities were on behalf of HHS to provide that capability. And so as those products are starting to be developed, I'd like to get back to you with the results on how those are being working out.
Do you know of those capabilities that are being developed, what percentage of those new pharmaceuticals will be provided and set aside for our men and women in uniform versus just the general public?
Both of those capabilities would be for HHS, for the general public. Those have not been specific for DoD.
And are the capabilities just in general, or has this money been dedicated just to COVID-related medicines?
Based on the continuous award, that was focused on COVID-related medicines.
Okay, so we're not using the Defense Production Act just to expand our general pharmaceutical development here in the United States that could be helpful for our soldiers, so we're not dependent on China. Is that correct?
We currently have no Defense Production Act awards in that area.
Okay. Are you aware of any additional capabilities that we need here as a committee to enable you to help with this? Because we need to certainly address this pandemic, but Representative Garamendi and myself and many of our colleagues who are on this call have a lot of concerns for our underlying dependence on China with our medicine. So do we need to do any more through the NDAA or legislation to get this production developed here so our troops aren't so reliant on China for some of our basic medicines and vaccines?
I would recommend that Brigadier General Paul Friedrich from the Joint Staff Surgeon General talk about what specific additional medicines we may need to support our troops.
Okay.
Congresswoman, this is Brigadier General Paul Friedrichs, the Joint Staff Surgeon. And first, I want to thank you and the members of this committee for the work that you have done in this area, because this is an absolute concern of ours, and we are grateful for the precedent that you've set in relooking at this. We have gone back through, based on the original language that you all had drafted, and looked at those operational medications that we rely on in our deployed assemblages. and identified which ones rely on ingredients from other countries. We are working with the FDA to obtain ingredients for those where we've not been able to identify the source of origin. And to your question about what other steps need to be taken, that is really the next step, is to understand fully through the global supply chain where all of the ingredients come from and ensure that pharmaceutical companies are able to share that information with us so that we can then identify what risk there is to those medications in our deployable assemblages. We continue to work closely with the Food and Drug Administration and the Department of Health and Human Services on this as we identify those risks and then identify opportunities to mitigate them. Ma'am, I hope that answers your question.
Thank you. It's very helpful, and I look forward to working with you and try to get this information as quickly as possible. But thank you for your time there, Mr. Chairman. I yield back.
Thank you very much, Ms. Harsley. Thank you, General, for your response on that. In the larger context, we have discovered that much of what we depend upon for the military and for our domestic use in this pandemic and beyond is not produced in America. This is one example of that problem, and there are numerous other examples. The President has established a Buy America policy, and that's for the military as well as all other government purchases. And so we'll be following that along closely. We would appreciate some more detailed information on this pharmaceutical issue. Our next witness is, our next questioner, Mr. Carbajal, you're up.
Thank you, Mr. Chair. General Nordhaus, in the week since the National Guard mobilized to respond to the January 6th violent extremist insurrection mob, and for the presidential inauguration, there were reports that hundreds of Guard members on duty in D.C. tested positive for COVID-19. What procedures did the Guard have in place to test members before arriving in D.C., while in D.C., or before returning home? Did the Guard conduct contact tracing for members who tested positive? And the reason I ask is I think it goes to the heart of our readiness. Do we already have the infrastructure and procedures and protocols in place to protect our service members as well as those that they are around?
Congressman, thank you very much for the question. We follow all CDC guidance, and as those folks deployed, you know, they do testing and screening from a standpoint of temperature and checks to make sure that they're healthy. They pass the questionnaires, and then they deployed into D.C. I will say that the positives, once we tested somebody, they go through the normal health requirements there to get tested. If they tested positive, the D.C. National Guard and their organization worked through the contract tracing to make sure that they identified members that needed to go into restriction of movement, and they continued that over the last month now. And I will say that from the numbers I've seen, they've done a really good job, and they've continued to reduce that to be able to find where those positives are, and then do the contract tracing, do appropriate restriction of movement to ensure that they can minimize any impacts to the mission.
Thank you. General Talaferro, if I heard correctly, 1/3 of our service members are refusing the vaccination. What is the department doing to reach out to our service members to encourage them to be vaccinated? And, you know, when I served in the Marine Corps, I don't think I was ever given an option about my vaccinations. We just got in line and they zapped us and everybody got it. And that was just the way it was. Are you saying that now we have a new approach to vaccinations for our service members?
Congressman, I wouldn't say we have a new approach. There's still a variety of vaccinations that are mandatory. The fact that this is authorized under emergency use authorization is what puts it in the category of being a voluntary vaccination. And, you know, I think it's most effective to think about the numbers that have accepted. Certainly service members can accept, or, you know, we don't precisely know why an individual has not received a vaccine. We think it's important that the department continue to communicate to our service members the value of the vaccine, the safety of the vaccine, with continued leadership involvement to help our service members understand that.
Thank you. Mr. Celestis, I appreciate the support the department has provided to states throughout providing personnel for testing sites, food distribution, and designating alternate care facilities. I understand the department has announced that it will send active duty service members to support 5 FEMA vaccination sites and are currently evaluating additional requests. What criteria does the department use when evaluating these requests?
Congressman, we obviously look at a number of factors. First of all, obviously, because of the demand for vaccine support, that's the priority for the nation, and obviously we want to support that. We also look at the types of people that we're providing, medics, corpsmen, nurses, and obviously evaluate the impact on the department. The department is ready, prepared, and to support all of these vaccine centers that we've identified and are working with FEMA. The ones in California, as you mentioned, we've got ones planned for New York and Texas, and we'll work very closely with FEMA going forward, depending on the availability of medical people, nurses, medics, corpsmen, and those types of things. We weigh all of those things, but we understand this is a priority for the nation, and the department is ready and postured to support these vaccine centers.
Thank you. Mr. Chair, I yield back.
Thank you. Mr. Whitman, you're up next.
Thank you, Mr. Chairman. I appreciate our witnesses joining us today. I wanted to go to Mr. Salas and ask him specifically what Department of Defense is doing for our critical civilian support structure for the military. And I'll give you an example. Newport News Shipbuilding is one of our contractors that requires individuals to work in close quarters, and therefore vaccinations are critically important for them. Last week, they didn't receive their allocation of vaccines from the Virginia Department of Health. When that happens, that interrupts their ability to, obviously, to build ships, and that is, I know, common with a number of other folks that provide critical support services for the United States military, building systems. They're required to work in close quarters, and vaccinations are key. What's the Department of Defense doing to assure that there's not interruption of those efforts there, and making sure that the federally acquired vaccines are distributed to federal contractors who, again, by the very nature of their work, are required to work in close quarters, and making sure that they are doing their job to support our brave men and women in the military?
So, Congressman, again, the department has worked very closely to look at our beneficiaries, our military, our civilian, and specific contract support that's directly provided to the department. For the example, the Newport Shipyard, as you indicated, that's being supported by the state allocation. And so, as we look to the future, obviously, any of these critical areas, we're willing to, and obviously going to talk to these organizations to see how and what we can do to assist. But as we see the increase in vaccination and capability from Pfizer and Moderna, we'll be able to provide more support collectively to these critical essential workers that have been identified. In each one of the states, following the CDC guidance, again, essential workers are identified. So I'm optimistic that the Newport shipbuilding community will be receiving their vaccine in short order.
I just hope to follow up with not just Newport News, but other companies that perform critical functions for our military, to make sure that there's no interruption in vaccines there, because when it does, it's a workforce interruption, and that's not what we need to be doing. One other question too is about health protection condition levels. What latitude do local commanders have in changing health protection condition levels? In other words, are you giving them the flexibility to determine conditions on literally a day-by-day basis? Because They know best about what's needed to protect the health of their people under their command.
Congressman, there is that flexibility to do that. I'll turn it over to the Joint Staff, but it's obviously dependent upon the positivity rate within the community, the hospitalization rate, and obviously those are the indicators, but the local commanders at the installation set the health condition levels.
Congressman, this is General Tolliver. We think you're exactly right that nobody knows better than the local commander what's happening in that local area, especially connections to local leaders, whether that's leadership or medical facilities. And while DoD instructions give general guidance of things to consider, it's fully within the hands of local commanders to make that decision.
Very good. Well, listen, I appreciate that. That's key. I know as I've spoken to some local commanders.
Mr. Whitman, we seem to have lost you. Mr. Whitman? We will move on. And if Mr. Whitman comes back, he's late. Our next witness is, our next questioner is Mr. Brown.
Thank you, Mr. Chairman, and thank you, gentlemen, for being here today. So we've heard during the testimony that the department can mandate a vaccine if it's formally licensed by the FDA. Is that authority to mandate a vaccine, let's say, for example, influenza, or when the service member deploys to an area where a vaccination is required, is that express authority granted in statute by Congress, or is that the power of the president as commander-in-chief?
And Congressman, I'm going to defer to General Friedrichs, the Joint Staff Surgeon.
Okay.
Congressman, this is Brigadier General Paul Friedrichs. Thank you very much. That is authority vested in statute, and the statute is written to state that those drugs which are not under an emergency use authorization can be mandated. Those which are under an emergency use authorization may not be mandated, except in certain extraordinary circumstances laid out in the statute. Does that answer?
So, no, and I really appreciate that. I want to kind of flush that out so that Congress, that we make sure that you have the tools you need. Is there, in the planning, in the forecasting for when it comes to the take-up rates of the vaccine, is there a scenario in which the department might exercise the authority to mandate the COVID-19 vaccination under this this emergency use authorization?
Congressman, from a medical standpoint, I believe the legislation which you and your colleagues have written is sufficient to address the circumstances that we're facing today. And it's very clear legislation. We've worked closely with our Office of General Counsel to understand the intent and the specifics of the legislation. So we believe that you have given very
So essentially, the department could mandate that a service member receive the COVID-19 vaccination under the statutory authorization provided by Congress.
No, sir. The department could not mandate that. The department could.
Okay, but you said under certain circumstances. Give us an example of what would be that circumstance where, even with the emergency use authorization from the FDA, which is not the formal license, you could mandate the COVID-19 vaccination. What would be a circumstance?
Sir, there are no circumstances where the Department of Defense has the legislative authority to do that, and we can provide in a written response back to you the specific language on that. The certain circumstances would require action outside the Department of Defense.
Okay, no, I understand that, and thanks for the clarifying that.
Congressman, can I add to that discussion though? This is Bob Salas. I do think that we're in the beginning phases of this vaccine, and as General Tolliver pointed out, I do think the opportunity to educate, inform, and make sure that our service members, our civilians and contractors really understand the benefit of this going forward, I think will reduce that significantly.
Thank you. Are you keeping data? Are you surveying the force by demographics? Who's accepting the vaccine and who's not, either by gender, race, ethnicity, or any other relevant factor? And I ask that because there is a lower take-up rate in many communities around the country, in communities of color. Are you gathering or collecting that data, or are you making those observations?
Congressman, this is Brigadier General Friedrichs from the Joint Staff again. So we are collecting that data on acceptance rate, and as General Tolliver and General Nordhaus mentioned, our experience mirrors the preliminary data that we're seeing in other communities. We are actually digging into that and continuing to collect more data as we administer more vaccines. As we mentioned, the first priorities are healthcare workers, and that's the group for which we
by race and ethnicity. Are you collecting data by race and ethnicity?
Yes, sir, we are. And
okay, thank you, Mr. Chairman. I yield back.
Thank you, Mr. Brown. Thank you for those questions. I think we've gone through this issue of vaccination and required or not required. Mr. Scott, you're next.
Thank you, Mr. Chairman, and gentlemen, thank you for being here. My question revolves somewhat around data as well. Mine is specifically geared towards the infection rates, and are the infection rates that we are seeing in the DoD different from the infection rates that we're seeing in the general public? If so, what are the trends that we're seeing? We obviously have a more controlled environment than the general public does. So infection rates and the trends with regard to those rates versus the general public, what are we seeing?
Congressman, this is Brigadier General Friedrichs, the Joint Staff Surgeon. Thank you very much. So we have aggressively implemented those public health measures that the CDC has recommended, and as a result, we have seen a lower percent positive test rate in our population than in the general public over the last year. And that's been very consistent for the active duty force as we've gone forward. Our overall number of cases has risen and fallen as the number of cases across the United States has risen and fallen. So we have mirrored what's happening in the communities where our bases are located, but the percent of our force which is tested positive has been lower than what we've seen in other communities. In addition, we've seen a lower percent of the force who require hospitalization, and although we have had a few members of the force who have died as a result of COVID infections, that is a smaller number than in the general public, in part because we have a younger population, and in general, they're fairly active and healthy to serve.
Harken back to the days of Ronald Reagan and recognize some of the traditional conservative values and issues that the party strong.
All right, so Jim Banks is chiming in on my time. How much difference are you seeing in the rates versus the general public?
Congressman, I'm sorry, could you repeat the question, sir?
Are we 10% better? Are we 20% better? What is the difference in the infection rate between DoD personnel and the general public?
Congressman, the data that I'm most familiar with is the percent positive rate, and we have typically had about a 1% lower rate of tests which were positive compared to the general population, but that's varied from week to week as we look at it. I would be happy, if I may, to respond for the record with specific data on that, but it's been consistently at least a percentage point below the general population.
Okay. I'm interested in that data, and I do think that it's extremely important that we keep it. We don't know how long these vaccines are going to work. And so we don't know when the second round of vaccinations is going to happen. And I think that the data, especially in the more controlled environment, although it's not perfectly controlled, it is more controlled than the general public, is going to be a big benefit to all of us as we push forward. I am concerned, and I mentioned this yesterday in the hearing, I am concerned about our teams, for example, our ODA teams that are out in Africa that work in these train and equip missions where they're in very close proximity in order to do their job with people from other countries. I would be interested in how you intend to handle that with regard to what I would refer to as partner forces. Are we testing those partner forces? Are we checking fevers before we do a training mission with them? How are we handling ODA missions, for example, with partner forces?
Congressman, it's General Tolliver. I'd say in general, the forces in those areas are practicing good force health protection measures of distancing, mask wearing, in some cases distributed operations, distributed training by an ODA team in an area like that, hygiene awareness, and we believe that the forces we're partnering with are generally following the same procedures we are, but I don't have the details at present on those specific ODA teams.
Okay, I'm almost out of time. General Nordhaus, Tom Cardin, and Tom Grabowski would want me to tell you hello. They've done a great job, especially months and months ago. They were out there in our nursing homes with the Georgia Guard, helping them kill this virus, and certainly appreciate all that the Guard's doing in Georgia and in Washington as well right now. Gentlemen, thank you, and my time's expired.
Thank you. Mr. Kim.
Thank you, Chairman. Thank you, everyone, for joining here and talking with us about this incredibly important issue. I wanted to shift a little bit here in terms of the questioning. Many of us represent military bases and installations in our district. I represent Joint Base McGuire-Dix Lakehurst, and that joint base is really an anchor to an entire community, not just of the service members, but outside around us. I want to just ask 2 or 3 questions about this. I had a town hall last night, and on the town hall there was a veteran who lives just outside the joint base, who says he's dependent upon access to the commissary for his food. He's someone who does not have a lot of money. He was telling me just the struggles he's had financially because of this, but he's had a tremendous amount of difficulty getting onto the base because of COVID restrictions. So I guess I just wanted to ask you, what work has DoD done to try to think about just the broader community here, how we are looking out for veterans in particular, many of them who settle down and live right around the bases where they retire from? Is there anything else we can be doing to help them get access to the commissary and other services on the base and other ways we can integrate them into some of our thinking of COVID response from DoD? Maybe we can have that over to Major General Tolliver.
Thanks, Congressman. I'd say that in the setting of the health protection condition measures, I think not just at the local level, but certainly at the department, we're aware of the dependencies in the community. There are a lot of linkages to the local community that commanders need to be aware of when they're going to the more extensive measures like, say, health protection condition Delta, where some of those people would not be allowed access to the base. There are lots of linkages at those levels, whether it's contractors, different support that comes from off the base onto the base. Certainly the support the base provides to dependents, veterans, or other beneficiaries in the area. So I know that our commanders are aware of that. But when they reach circumstances that require those kinds of drastic measures, they take them, but I know they're conscious of them.
Well, look, I appreciate that. And one thing I'll just say here is open communication and just kind of transparency on that front goes a long way. I think a lot of the problems here, I mean, I'll tell you, I get more calls about this than almost any other issue from the veterans community right now. And I think just some open communication about, about the timing or the reason for the restrictions at my base as well as around the country, I'm sure will be helpful. The last question here, just kind of on a different side of this coin. I've talked to the number of service members in my district. They're young parents. They got little kids like I do. I got a 3-year-old and a 5-year-old. I know the struggles about childcare right now. And I know that a number of our service members have struggled with this. It's put an enormous burden upon them and their ability to do their work, as well as their spouses. And we already put way too much burden upon military spouses as well. As we know, unemployment for them is through the roof. I wanted to just kind of hear from you, just what is your thinking about what it is that we can do to support service members, their families, their spouses, when it comes to childcare and other elements for their children? Is there more that we can do? As I know many childcare centers have been closed or have big restrictions on that front. Over to you.
Congressman, this is Bob Salas. So in the Defense Department, we have over 200 child development centers and currently have about 180 open. Obviously, they're not open at full capacity, but we're always looking at the kind of mitigation measures that can be put in place to ensure that we can maximize those child development centers. I think the broader issue within the community is the same thing. There's a lot of good work that's been done within the Defense Department to come up with the procedures so that we can have safe and effective child development centers open. Certainly willing to share that kind of information with the community and others. I think that's the key to success is working together both inside the community and with the installations, those local installations, to gain a better knowledge and understanding of the best practices that we could share amongst each other to make sure that we can maximize the child care capabilities both on the DoD installations and outside the DoD installations.
Thank you. Gentleman's time has expired. Mr. Desjardins.
Good afternoon, and thanks to the panel for the great testimony today. For any of those who are at the Capitol, and I think most of you are, you probably experienced a much different city than you're used to as you tried to enter through one-way lanes, through razor wires and gates. And so, Mr. Salas, I wanted to reference your internal email dated January 20th of 21, where you're discussing the National Guard's presence in D.C. at least through the fall of 2021. First, how many guardsmen nationally are responding for the COVID effort right now?
So, Congressman, it's 23 or 24,000? What's the number?
For COVID?
For COVID.
For COVID is 28,430.
Okay, thank you. And so the extended role at the Capitol, would that, in your opinion, divert valuable personnel and resources away providing further COVID-related assistance?
Congressman, that would depend on what level of National Guard was needed to support the Capitol security.
Right. And what is there, roughly about 6,200 still deployed?
Within the NCR, that's about the right number, Congressman. We have about 4,900 on the Capitol grounds. We also have National Guard members supporting Secret Service and currently supporting MPD, the Metropolitan Police Department.
And we certainly appreciate their service. I've had the opportunity to talk to many of them, and they're doing an admirable job. Major General Nordhaus mentioned in his opening remarks that we have not seen National Guard called upon to serve in such numbers since World War II, and that military officials have already estimated that the cost of the Capitol deployment will near $500 million just through mid-March. So now more than ever, is it important to continue to devote these resources, or can you share with the committee some credible threats that would require us continuing to have such a presence in the nation's capital?
Go ahead.
Sir, if that question was to Major General Nordhaus, sir, right now we are scheduled to end the National Guard on roughly 12 March, and Pending any other information, we'll work with our interagency partners like we always do, the Office of Secretary of Defense, to continue to support if things change.
Okay, so as of now, you can't share with the committee any credible threats that have been identified, so you're planning on sending the 5,000 guardsmen home?
But Congressman, we obviously work with our law enforcement partners to determine that threat, and that's obviously continuing to evolve. And at this time, I'm not aware of a threat that is out there, but that evolves all the time, Congressman. So we have to work closely with our federal law enforcement partners to understand that.
Parents Capitol, which some have dubbed Fort Pelosi, it's really discouraging to see the razor wire, the fencing, the image that it sends to the world. So if that threat no longer exists, I would hope that we can return to normal and that these guardsmen who've served so admirably could possibly be utilized in other ways and help with the COVID effort. And if anyone has any further response, that's great. If not, I yield back.
Thank you. I do want to emphasize that point. I mean, I have some sympathy, other than the unnecessary shot at our speaker. I have some sympathy for the concern that's being explained there that I hope you gentlemen will take seriously, and I've raised this issue with the Pentagon as well. As I understand the threat environment right now, it is very hard to justify the current security presence around the Capitol based on the threat environment that we now see. And my great fear is that this becomes permanent, because there's always a threat. I mean, you know, I've been here for 24 years and certain bad things have happened. Certainly the insurrection took that to a whole nother concerning level. And I know you guys don't make the decision on this. I just want to amplify Mr. Desjardins' point. This is the United States Capitol. People are supposed to be able to come here and petition their government, all right? And I can barely get in at this point. So I just hope we balance the risk with the job it is that we're all supposed to be performing here, understanding that COVID is part of this as well. You know, and I have had conversations with the Speaker about this and conversations with General Honoré about this. I hope we think about the balance. If you look at it from the standpoint of, well, let's just eliminate all risk, okay? If we were going to eliminate all risk to our individual members, we'd do everything remotely. We'd never leave the house, okay? We cannot be afraid of our constituents and do our job. So I hope we'll figure out a better balance on how to make that work. With that, Ms. Houlihan is recognized.
Thank you, Chairman. And I guess my question might be a good follow-up to that, which is that in an alternative world where we deploy our National Guard in a different way other than at our Capitol, some states have been successful in getting their National Guard to be able to support vaccine deployment efforts. And I was wondering if I might be able to ask Major General Nordhaus, I think that probably is the most appropriate person to ask, are there any obstacles that you're aware of to scaling up the use of the Guard in this way? What would that look like if we did that in a larger scaled effort? And has the DoD considered how they plan to scale up the vaccination efforts when and if other vaccine candidates are approved for use?
Congresswoman, thank you very much for the question. I know of no impediments right now. We've seen the number of guardsmen on 502F increase over the last 3 to 4 weeks. We're now up to 28,430, as I discussed earlier. I believe what we're seeing is that increase. So we started out with just a few vaccination sites of our guardsmen vaccinating civilians in early January. And as I briefed today, it's 350, and I know those numbers continue to climb as we're supporting those vaccines. Some states are using, like in Washington, I know is doing a great job. They have 150 service members out there. They have 30-person teams. They have 4 static teams that are at specific locations and another mobile team that's going around to long-term care facilities and vaccinating those members. Other states are using smaller teams that are going out to very rural areas that are some underserved population to make sure that vaccines are available out there. But as I think we'll continue to see, the states will utilize the guardsmen to be able to get after these vaccination efforts.
Would anybody else like to add to that before I ask my next question?
Congressman, this is Bob Salas. I think it's a combination of things. What we're seeing is, obviously, across the country, there's roughly 30,000 points of administration. A lot of those are community-based, state-based. As you pointed out, DoD is working very closely with FEMA on these mega and large centers that would provide tremendous throughput on vaccines. The other thing that's going on is obviously the work with the private sector, in particular with organizations like CVS and Walgreens and many others. That is an opportunity, again, to expand the vaccine administration community. And we believe that moving ahead, that along with the community-based, the state-based, the federally supported, and the private sector will expand that capability to deliver the vaccine. This is a very positive development with the increased level of vaccination that's going to be available and the increased number of locations that will be available. And the Department of Defense's role in this is, again, to support these mega centers and obviously to support the National Guard and supporting the states and what they're doing.
So how are you, and I don't know which one of you might be the most appropriate to answer this, but you spoke about the different ways that we're deploying our Guard and the different kinds of rural areas or mobile areas. How are you choosing the locations in which you offer to support the non-DoD efforts?
So for the DoD support, we work through FEMA. FEMA works with the state to make the determination of where those vaccination centers will go. I'll turn it over to General Nordhaus to talk about how the state works with the Guard to support that.
Yes, ma'am. Major General Nordhaus here. With the state health departments, they really work with FEMA and with the National Guard and the other agencies within the state, and they determine the best places to make sure that they can get the vaccine across their state with the allocations that they receive.
Thank you. I appreciate that. I have less than a minute, and I'm hoping that maybe I could ask Mr. Salas, I hope I'm pronouncing that correctly, a question regarding pregnant active duty members. I understand that we've been talking a lot about our military and our vaccination process for the general population, but people who are pregnant would be in the 1A vaccination. How is the DoD factoring in pregnancy status into vaccine prioritization across the active and reserve forces? Some of our colleagues have mentioned that they have concerns about getting vaccinated, but what guidance are we giving to healthcare personnel about providing information to women who are pregnant to make this decision about getting vaccinated or not?
Congressman, this is Brigadier General Friedrichs, and we are very closely following the CDC recommendations on that and providing the same evidence-based advice that the Centers for Disease Control has provided on the safety of the vaccines across the general population, and in particular for those who are pregnant or have other medical conditions.
Thank you. The gentleman.
Thank you, and I yield back. I've run out of time.
Thank you. Mr. Kelly is recognized for 5 minutes.
Thank you, Mr. Chairman. My first question has to do with 502F orders for folks who are on COVID or service members who are on COVID support. And while it's very important that we be able to respond to this, it's also very important that we maintain our operational readiness in the National Guard and Reserves and Compo 2 and Compo 3. Currently, under DoD policy, when a service member is on COVID orders and they have an AT period, annual training period, we have the 155th Brigade that is getting ready to go to the National Training Center for a rotation. They have to come off 502F orders, which means they go back into National Guard status. They lose their Tricare benefits for them and their families, and then 3 weeks later, they go back on COVID orders. With the stroke of a pen, we can change that so that it is either waived and they can stay on Tricare while they go on those other orders, or we can just allow them to do AT status during that. Do any of you have any response if anyone's looking at this? Because this is going to impact up to 3,500 members of the Mississippi National Guard this year, and it's affecting soldiers all across the nation.
Congressman Major General Nordhaus here. I believe that has been resolved through the FEMA MAs, and that all the state needs to do is let them know which days that they're on military and not performing in support of the mission assignments from FEMA, and then they stay on the orders, and they just complete the reimbursable difference between those days.
That is great. Just make sure that we're following through and that all states understand this, because I know I dealt with this, I think, last week, and that was in the initial stages, and I knew we sent up an RFI on that. Second, what amount of our special operation forces have been vaccinated? Those who are currently, we had Austin Scott talk about those guys downrange. What percentage of our special operation forces have been vaccinated at this point, or do we have that number?
So, Congressman, we don't have that specific number with us, but we each area is working through allocations both at the service level, the combat command level, and the installation level to work down the population schema of priorities. So as they reach critical national capabilities, those national response forces would be vaccinated at that time.
And finally, Mr. Chairman, and also the members, I want to ask them, the emergency use of the vaccine on service members and not being allowed them to be mandatory, that just doesn't make sense. If we're saying the process is safe, we need to portray that in our use on our DoD employees to set the standard and to set an example. So do you guys on the panel, do you think it would be helpful if we change that in Congress so that emergency use vaccines, that they can be, not shall be, can be mandatory to service members? Would that be helpful to you?
Let me pass that to General Friedrichs.
Congressman Brigadier General Friedrichs, thank you very much. I think that would be a discussion that we would need to have with the Centers for Disease Control, the Department of Health and Human Services, as well as the Department of Defense. It is going to depend on the specifics of the vaccine in question, and I very much appreciate the continued concern about this issue. No one is more interested, I think, than, as we know, you and the members of this committee are.
Let me interrupt real quickly. My point is, if we say it can be, it allows DoD to look at different diseases. Currently, we can't make it mandatory. And I'm not just talking about this pandemic, but the next one and the next one. Would it be helpful if we said DoD can, not shall, make mandatory, can make mandatory, so that we can use the science and the CDC as each specific disease rather than now having our hands tied?
Congressman, speaking as a physician, it is always helpful to partner with you and with our colleagues in the CDC and HHS in crafting language that allows us to respond to each pandemic or biological threat as it occurs. As you said, they will each be different. It will be difficult to write language that will cover everything, but we look forward to working with you on that, sir.
Thank you. The gentleman's time has expired.
Yield back.
Mr. Morelli is recognized for 5 minutes. Mr. Morelli, are you with us? Okay, I think we just lost him. So I think Ms. Jacobs, are you online?
I'm here, and thank you, Mr. Chairman. Thank you, and thank you everyone for being here today on this critical topic. To follow up on Mr. Brown's questioning, I want to thank you for offering to provide us with the specific legal authority that you, in conjunction with the Office of Legal Counsel, are relying on to assess whether or not you can mandate service members to be vaccinated. And I just want to say that I, too, am very eager to see that specific legal analysis and will look forward to you sending it. Next, I represent a district in San Diego, which, as you know, is the home port of the Mercy. And while the Mercy was deployed to Los Angeles earlier during the pandemic, it's my understanding that the ship was not heavily utilized. The ship's mission was to treat patients other than those with COVID, freeing up hospitals to deal with the virus. but it seems as though few medical providers actually made use of the facilities aboard the ship. I was just wondering if you have any insight as to why this was the case. Is the department looking at ways to make it easier for both the Mercy and the Comfort to better assist the homeland should that need rise again in the future?
Congresswoman, as General Tolliver, I can address that. Most of our fielded medical capabilities are designed to deploy to a wartime environment and do trauma care. That does not make them perfectly equipped for disease control as is needed during the pandemic. But moreover, we found that as we, due to the low utilization of some of these traditional fielded medical capabilities, we found it much more effective to deploy our personnel to existing infrastructure, whether that be existing hospitals or medical centers, because largely we found that those hospitals and centers were not short on physical capacity. They were short on staff, the ability to staff more beds, the availability to utilize the equipment and capacity they had. And with the addition of DoD personnel, medical personnel, to expand their internal capacity, it actually allowed our personnel to be much more effective in the response, allowed those hospitals to treat people where the people wanted to be treated, and that was an evolution that made our forces much more capable.
Thank you for that. And then just lastly, I want to reiterate what some of my colleagues have said. I've been hearing from service members on the ground just how difficult the child care options have been for them during this crisis, and even potentially more concerning that even the child care facilities that remain open, they don't feel are necessarily upholding COVID protocols and keeping the staff and their children safe. So I look forward to continuing to work with you all to make sure that we address that issue. With that, I yield back.
Thank you. Mr. Green is recognized for 5 minutes.
Thank you, Mr. Chairman. And I'd like to thank you and Ranking Member Rogers for the opportunity to serve together and to continue the great work that you guys have done caring for our brave men and women in uniform. I'd also like to say to Ranking Member Rogers, I've gotten to know him personally while working under his leadership at Homeland Security. Sir, it's been great to work with you there, and I look forward to and am proud to serve with you now. My time as an airborne ranger and Army physician assigned with some of our Tier 1 Special Forces units gave me a love for those who stand in defense of our freedoms. They would die for us, and I believe every member of this committee has a similar devotion and dedication to them. So it's a real honor for me to be here, and also the chance to take care of, in my district, Fort Campbell, and the men and women who are serving from that base, kicking doors and taking names across the globe to defend our freedom is a real honor. As an Army physician who did research both at Walter Reed and USAMRIID during medical school and research with soldiers and on soldiers in residency, I'd like to put to bed this issue that I keep hearing about using research medications on active duty soldiers. There is statute passed by Congress previously in National Defense Authorization Acts that prevent, because of Tuskegee Airmen and what happened there, legislation was passed to prevent the use of any experimental medication on an active duty soldier. We did research myself on pain management and residency, and we're not able to use anything but an FDA approved drug for that. It is written into law. I think it's a bad idea to change it in a blanket statement because, or a blanket law, because we need the full blown research done before we saddle our warriors with an experimental medication. And I can help the committee find that NDAA and the witnesses find that NDAA if it's necessary. I do have some questions for our witnesses, and I appreciate you being here. Can either of you kind of share, the impact of the covering the COVID requirements on training and readiness, and specifically, were there any JRTC rotations that were canceled? Were there NTC cycles that were canceled? What are some of the specific examples of the impact And when we make this training up, what's the impact going to be on op tempo?
Congressman, it's General Tolliver. I can address that. In the early days of the pandemic, the services did cancel or delay some of the large force exercises, like you mentioned, whether that's a National Training Center rotation or a red flag or the like. Overseas are joint exercises executed by the combatant commands. Over the last year, 99 exercises have been canceled. That would have included about 40,000 U.S. and partner forces partnering with 46 different countries, and 37 exercises were postponed with almost 50,000 U.S. and partners. That would have included 27 countries. And I think the overseas training and the large force exercise training in the United States are similar, but there are some key differences. The large force exercises in the United States provide that infrequent opportunity to have a very complicated, realistic training scenario that only occurs a few times in a service member's career, and that's the qualitative.
I really hate to interrupt you, especially having served in the military, and I don't like interrupting a two-star general, but what is the time it's going to take to return to the level of training when we make all this up? I mean, how long is it going to take us to make all this up, and what's the impact on the op tempo? I only have about a minute left, so that's why I jumped in and interrupted.
Yes, sir. And so, Congressman, in most cases, it won't be made up. It will be an opportunity lost for that large force training, and that the services have done an outstanding job adapting and substituting small force elements during that space.
Okay. I only have 20 seconds left, so Chairman, I'll yield.
Thank you. Mr. Kihili is recognized for 5 minutes.
All right, thank you, Chair. This question is for General Nordhaus. Good morning, General, and thank you for all the participants who are on today's call. My question specifically has to do with National Guardsmen who are on Title 32 502F. I suspect this is an issue that is existing in the other 49 states. But as you are well aware, Section 733 of the most recently passed NDAA provided for transitional health benefits for certain members of the National Guard that are serving under orders in response to COVID-19. What has happened is National Guardsmen currently that are coming off and are eligible because they've been on Title 32F for the last at least 30 days are unable to get TAMP, or the Transitional Assistance Management Program, which allows them to continue their Tricare for up to 180 days, as described in the most recently passed NDAA. Now, after researching it seems there's a disconnect between the inability for Tricare to manually activate those service members, those eligible service members into TAMP. OSD has been working with DMDC to actively fix it, but their expected implementation date is not until March 20th, 2021. I find that unacceptable for our eligible National Guard soldiers and airmen and their families who, since the passage of the NDA, I don't know if it was retroactive to National Guardsmen who have been on Title 32 502F since last March. But for the National Guardsmen that have been on 502F orders since the passage of the NDAA, who have been on orders for the last 30 days and have come off those orders, they should be transitioned right into TAMP and not have to wait until March 20th of 2021. There should be no break in their Tricare Prime healthcare benefits. And my questions are, what are we going to do to address this? Why is DMDC unable to implement this today for eligible service members? What is OSD currently doing to address this situation immediately? And why is there not a process to manually activate TAMP for eligible soldiers and airmen who have been on Title 32 502F orders since the passage of the National Defense Authorization Act to today? That's my question, sir.
Congressman, first of all, I want to start off by thanking you for your service in COVID-19 in Hawaii. I know you served on state active duty, and this issue that you have just brought up to me, I will have to look more into it, and we'll have to make sure that we do everything we can to follow the law that was passed to make sure that we can take care of our service members through TAMP. I'll yield to anyone else on the panel that has further information than I do. Sir, so
and we could follow up, sir, if we don't have those answers. I'm just concerned because I know at least 21 National Guardsmen here in Hawaii, soldiers and airmen who have performed at least 30 days of Title 32F since the NDA has passed, that are being told that they cannot, as you well know, the day you come off active duty orders is the day you drop out of DEERS and you are no longer eligible for Tricare Prime for you and your families, and they should roll right over into TAMP, and it's not happening. And they're being told they need to wait for at least 5 weeks before that's going to happen, and that's 1 month without these service members and their families, being covered by Tricare. So it's an immediate concern for me because that's a real situation happening here in Hawaii today, and I suspect it's happening in every other state in the country, like Congressman Kelly in Mississippi mentioned earlier. These benefits are not transitioning to the service member who has earned them.
Congressman, I'll look into that today with our Surgeon General and our J1 to make sure that we figure out what the issue is, and we'll provide a response back.
Great, thank you, and thanks for acknowledging my service. I was also on Title 32F, 502F orders for almost 120 days from April to August, and it was a great service to the state of Hawaii to do that. So thank you.
Thank you. Mr. Waltz is recognized for 5 minutes. Mr. Waltz, are you with us?
Yeah. Thank you, Mr. Chairman. I'm with you. Can you hear me okay?
Yes, we got you. Go ahead.
Yeah, I just, and this is open to anyone in the panel. I wanted to follow up on the Congressman Desjardins' question in terms of the analysis that's going on NGB, how we got to the current number of guardsmen in the Capitol, the threat that then
We don't have you anymore. We're not hearing you, Mr. Waltz. I don't know if you accidentally hit mute or if we just got a connection.
drove that. Can you? Nope. Can you hear me okay?
We got you now. We lost you for about 20 seconds. You might want to start over. Well, now you're completely lost. Well, there we go. We got a picture. Yeah.
Okay. How about now, Mr. Chairman? Apologies.
Yeah, we hear you now. So we could do this all day long.
Okay.
One more shot. Go ahead.
One more shot. I hope I got it all out. The analysis is driving the number on the Capitol and the opportunity cost of other other domestic support missions. Hopefully I got that out.
I think his question is, what aren't we doing because of what's happening, what the Guard being used at the Capitol?
Congressman, copy your question from our guardsmen that have responded to the request for assistance by lead federal agencies. Our guardsmen, have left their jobs and what they were doing back in their states to support this mission set. There's additional training that they could be doing, obviously, and then there's preparations for any COVID response that is within their state that they might be missing out. To the exact specific for each state and each individual, I can't speak to exactly what they're missing out on.
No, thank you. And thank you, Mr. Chairman. I'm looking at what's driving the number that's there. the 5,000 to 7,000 number, and then what's the plan going forward? I can tell you, also serving as a guardsman, the force is exhausted between COVID, ongoing overseas requirements, the training that's required for those requirements, natural disaster, particularly in states like Florida, Texas, California. I worry a lagging indicator is going to be retention. So again, the opportunity cost, what's driving that number of 7,000? And then what is the plan for the foreseeable future so that we can get those men and women back to the States?
Congressman Waltz, this is Bob Salas. What drives the requirement is really the agency, department, federal law enforcement entity that provides the request to the department. For example, Secret Service, we're providing support right now. We're also providing support to the Metropolitan Police, provided to the Park Police. Specifically to the Capitol Police set the requirement for the number. The number was based on different missions that the National Guard members would be supporting, response force, perimeter security, those kinds of mission sets. Again, we're working with them. As you know, the current request ends on March 12th. What we're trying to determine with them is what is the right level of security that they need from the National Guard, considering that the circumstances have changed. Again, the Defense Department, as you know too, is highly dependent upon federal law enforcement to provide us the insight into what the threat may be, because obviously the department doesn't do that domestically. So we work very closely with the FBI and the Secret Service and others and the Capitol Police to try to determine what they believe that threat is, and then looking at what they believe is the need for the National Guard or the types of mission sets that they need support from. We work very closely with them to try to understand what that is. Obviously, 4,900 is a very large number here on the Capitol.
Thank you. And Chairman, if I just one quick follow-up. Look, the Air Force is probably one of the best at this. When it comes to requirements, it's saying, don't tell us what platform to use or what weapon to use. Tell us what effect you want us to have. I know you can't permanently be in a position of just giving every number that you're asked for. There's some analysis on the Guard and on the Pentagon's end of what it takes to actually have that effect. And I would be interested if I could ask for a response on the record for what is the plan going forward past March 12th. Thank you so much, Mr. Chairman. I yield.
Thank you. He by on the record, he means submit it in writing.
Correct, sir. I'd just like to add one thing
yes.
to that, Congressman Waltz's question there. And simply, we realize that personnel is part of this, but we also understand that infrastructure and technology is a large part of this that can potentially provide the additional security. So it's the combination of those things. And as the Congressman rightly points out, it's that kind of analysis that will help us understand what the real personnel requirements are.
Understood. Having piped up earlier on this subject, I do want to follow up on just a couple of crucial points. One, you said this, but I want to make it clear. You are responding to what the Capitol Police and the city of Washington, D.C., and the Speaker's office and the Majority Leader's office in the Senate is asking you to do. This is not your independent assessment. You are responding to that request. So the decisions making on this are not being 100% made by you, taking Mr. Waltz's point that you do have to sort of figure out how to achieve that effect. It's being driven locally. And the second thing I would say is in terms of the threat environment, I've looked at it, and I agree that the threat environment is less, but if you want to know what's driving the threat environment, it would be helpful if every single elected official and person in a position of power in this country publicly acknowledged that Joe Biden was the duly elected president in a free and fair election. The degree to which people are still driving that narrative then gets taken and put into really wacky sets of arguments that motivate people to say things, and I'm sure everyone's aware of this right now. March 4th, and I love this, by the way. Sorry, I have a sense of humor about absolutely everything, regardless of the circumstances. So apparently some of these people have figured out that 75 years ago, the president used to be inaugurated on March 4th. Okay, now why that's relevant, God knows. But at any rate, so now they're thinking maybe we should gather again and storm the Capitol on March 4th. Okay, that is circulating online, all right? Yeah, stuff like that circulates all the time. Does it mean it's going to happen? Probably not. But if you want to help Tell them not to do that. Tell them that the election is over. Joe Biden won. It was a free and fair election, and let's get to work. That, too, would help reduce the, well, I don't know, fear/paranoia that people feel that requires everything that we're seeing around here. So both sides could be helpful in getting our capital back to normal, I guess is what I would say. All right, I think Mr. Morelli is now with us.
Mr. Chairman, you certainly have a commitment from me.
All right, thank you, I appreciate that. Mr. Morelli, I think we're going to give you another shot here. Are you with us?
I am, Mr. Chair.
You're up. Ask for 5 minutes.
Yes, thank you, sir. I will be very brief. I just wanted to thank the individuals who are testifying. Thank you, Mr. Chairman, for a very important and enlightening hearing. And as I am brand new to this committee, I'm going to stop talking, yield back, and observe my colleagues in this. But I do want to thank people, and I also, to the National Guard, General Taliaferro, we lost 3 guards men in Rochester, New York, my hometown, with a helicopter crash just a couple of weeks ago. And I want to express my condolences to you and to the members of the Guard who do extraordinary service, as do all of our active personnel. With that, I yield back, Mr. Chair.
Thank you. I'm sorry, Mike, did you have some? No, sir, you've got a bright future. Yes, I'm sorry, Mr. Rogers made the comment that Mr. Morelli has a bright future on this committee, and I heartily agree. Mr. Bice, or sorry, Mrs. Bice, you are recognized.
Thank you, Mr. Chairman. My question is really directed specifically as it relates to my congressional district. I am near Tinker Air Force Base, and there are approximately 3,000 military personnel that work on base, but there are 25,000 civilians that work on base. What is the process that DoD is using to make sure that those civilian base employees are accessing the vaccine? Is that being left up to the local community, or is that something that DoD is working actively to assist in making sure that those folks have access to the vaccine so that they're not, potentially exposing the military personnel that are working on base?
Congresswoman, I'm going to turn it over to General Friedrichs, but the DoD civilians are in our vaccine schema, and depending on what jobs they're performing and what their health conditions are, will guide exactly when they get the vaccine. But let me turn it over to General Friedrichs, Dr. Friedrichs.
Thank you, Congresswoman, and thank you, ASD Salasis. And that's exactly right. So as we have gone through our prioritization following those CDC criteria, we've identified those on our bases who are at increased risk, whether by age or reason of other medical conditions. And that includes those critical infrastructure personnel that you just mentioned who work on our bases there. So they are part of our schema. And as the vaccine allocations continue over the weeks and months ahead, we will continue to vaccinate those personnel.
And follow up, how much headway are you able to get on how much of the vaccine is being sent to a specific area or a specific community to be able to vaccinate those? And what I'm trying to figure out is how long is it going to take you to actually offer that vaccine to the almost 30,000 employees that work on base? Are we looking at several months down the road? How is the delivery process working?
Congresswoman, this is Brigadier General Friedrichs again. So we work closely with the Centers for Disease Control. Our Defense Health Agency is the lead for this effort, and so they work with Operation Warp Speed and the Centers for Disease Control on our allocation based on the populations that we've identified for which we are responsible. As was mentioned earlier in this brief, based on the purchases that the that the country has made, we anticipate having 600 million doses by the end of July, and so that should allow us to vaccinate all of the adults who wish to be vaccinated over the next several months.
Thank you for that. Follow-up question. We certainly have many parts of the world. We are relying on our allies as partners on the ground for operational support, intelligence sharing, and other critical functions. How has the pandemic impacted those relationships, and what are we doing to mitigate the impact?
Congresswoman, this is General Tolliver. I'd say our combatant commands are heavily focused on maintaining those critical international relationships, whether that's through exercises, key leader engagements, and they deliberately do so to maintain awareness of what's going on in the region, maintain access basing and overflight during a crisis, and so on.
I just want to say thank you for your service. Thank you for taking care of our men and women in the military. In Oklahoma, our National Guard is currently activated not only for COVID relief, but also for weather issues that we're experiencing here. So I'm grateful for the men and women not only serving in our Air Force and Navy that are here in Oklahoma, but also our National Guard that play an important role. I yield back, Mr. Chairman. Thank you.
Thank you. Mr. Panetta is recognized for 5 minutes.
Thank you, Mr. Chairman, Ranking Member Rogers, and all the gentlemen there. Appreciate your service and appreciate your time and preparation today to be here to answer these questions. Obviously, we're dealing, I agree with the President of the United States that we are dealing with a wartime effort. So I appreciate all of the involvement that the Department of Defense is currently undergoing with this right now, especially when it comes to the National Guard. I agree with you, General Nordhaus, especially on my district on the Central Coast of California. The National Guard has played a huge role within the last year, dealing with wildfires, dealing with storms, yes, dealing with COVID, but then obviously national dealing with the attacks on our democracy, but also bolstering our democracy with getting involved in securing many of the election sites around our country back in November. So thank you for that. Another area that was very beneficial are the food banks that I have in my district. I'm sure throughout many of the members' districts on this panel. Every week I try to get out to a food bank, and I can tell you the ones that have the National Guard members helping out are the ones that run the most efficiently, considering how long these lines are getting at our food banks. So thank you very much. Now, I read recently that the National Guard has 100 National Guard teams in 29 states with the ability of 200 additional teams for vaccine distribution. At least that was said by General Hawkinson the other day. And so what I kind of want to break down here is that, okay, so you got these FEMA national sites. Those are going to have active duty members. And then you have the state and local government sites. Those are going to be run by National Guard members. Am I correct in coming to that simple conclusion?
Congressman, this is Bob Salas. Yes, you are.
Okay, great. And so right now you have FEMA that has 1,100 troops, or they're asking they have 1,100 troops at 5 vaccination centers. The president has called for 100 more vaccination centers. That could lead up to 10,000 more service members, is what I'm reading. Do you expect all of those to be active duty members?
Congressman, that's the current plan, is to use active duty members to source the 100 mega and large centers. But that will depend based on, obviously, as we start to provide additional forces, the Joint Staff and the services will look at how best to do that. And there's the original, or at least the initial look, is to use active component forces. It could then lead to Title X reserve forces potentially to support those centers.
Understood. General Nordhaus, focusing on the National Guard at the state and local level, obviously we understand the priority of getting more vaccinations out there, especially to rural sites. If you're going to have FEMA at the major population centers, then maybe you help the state and local governments use National Guard to get those vaccination out there to those areas that aren't in the major population areas. Do you see that taking away from the food banks, or are you able to as General Hawkinson said, use those 200 additional teams for that type of those types of vaccinations in those types of areas?
Congressman, thanks for the question. I don't see it taken away right now within the states and territories due to the mission assignment from FEMA. Right now we're at about 28,000, but there's room to grow within each of the states. It's a little bit different. Up to 56,000 is the authority. So each state will look at what they need, what their critical requirements are. I know everyone is prioritizing vaccine distribution and vaccine shots to the population. And so that will be within each state to make sure they have the resources and the guardsmen there able to perform each of those duties and make sure they cover them.
Okay, thank you. Completely switching gears right now. Obviously, unfortunately, the Roosevelt has been back in the news lately. Three members of the Roosevelt came down with the coronavirus. And I know the Roosevelt is on a double bump right now, basically doing a second tour. My question to you is, where the hell and how the hell are these three members contracting the coronavirus? Is that being investigated?
So, Congressman, it's General Tolliver. I'm sure the command team is looking into the individual cases. I think the broader message is how much improvement the Navy has made over the last year in their procedures on their ships, the way they've identified pre-planned responses, the way they've changed flows of personnel, one-way corridors, different things, sleeping arrangements, segregating personnel into cohorts. The fact that there can be 3 infected personnel on the Roosevelt and it stay at 3 until they're evacuated is a credit to the work they've done that would keep it from getting to 1,200. Over.
Thank you. My time is up. I yield back. Thank you, Mr. Chairman.
Thank you, Mr. Panetta. Mr. Franklin, you're up.
Thank you, Mr. Chairman, and thank you, panel. I appreciate your time that you spent here with us this afternoon. It's been very enlightening. As a junior member of the committee, by the time we get to this point, a lot of the questions that I've had have been already answered, but I do appreciate that. We've touched, several folks have asked questions about the opportunity cost of missed training opportunities, the impact on readiness. As a former career naval officer, I've been on the receiving end of a lot of these missions that come above and beyond your regular op tempo. My question really to follow along, to continue on some of the others, is just dealing with retention. And I'm specifically curious to know, have we seen any drop in retention over the buildup and the op tempo of the last year or so? And are we taking any proactive measures to be on guard against that? Just in talking recently with senior leadership of our Florida Guard, I know we have concern about a lack of manning to begin with. And then on top of that, just the tempo and the impact that it's going to have on our troops. But I guess that question would be for General Nordhaus.
Sir, Major General Nordhaus, right now we haven't seen any dip in the retention at this point. I did hear numbers about our retention, our recruiting throughout the end of the year, and right now we're on par to be able to meet our end strength numbers through our recruiting efforts for both the Army National Guard and the Air National Guard. And I yield to to Major General Tolliver.
Congressman, it's General Tolliver. I'd say for the active component, retention and recruiting has still been at very high levels, and as you know, it generally follows the economy. And so I think this will bear watching as the economy picks up, but right now, retention and recruiting are at very high levels.
Great, thank you, gentlemen. I yield back.
Thank you, Mr. Franklin. Mr. Vasa, you're up.
Thank you very much. I wanted to ask General Nordhaus a question. In my district here in the Dallas-Fort Worth area, there was an announcement that there were going to be 2 openings of COVID vaccine sites. One was going to be at AT&T Stadium, Dallas Cowboys Stadium, which is in my district, and then another one in Fair Park, which is near my district, with the capacity to perhaps serve up to about 10,000 people a day. And I know that the Guard was supposed to be assisting in that effort. As you know, right now in this part of the world, we are having record low temperatures. Our grid has been not completely incapacitated, but has been downgraded severely. We have people just literally blocks away from me that have had power sometimes, and other times they haven't. Is this going to affect the Guard's effort to be able to mobilize and help in these efforts? Because I would imagine that there are Guardsmen that are also affected by these storms. Will you still be able to help in this mission as soon as we're able to get past this, or do you see there being some problems?
Congressman, thanks for the question. I'll pass it quickly over to Major General Tolliver. I will say that across the states that are receiving the weather right now, our Guard is helping with incidents within weather. but then they're right back as fast as possible to supporting the vaccination efforts. And the Dallas area, I believe that's one of the Title X efforts, and I'll turn that over to Major General Tolliver.
Thanks, General.
Thank you.
Congressman, those two sites in the Dallas area, one at AT&T Stadium and then one at the Cotton Bowl, we both expect to be operational a week from today. Although I just discussed this with Northern Command this morning, it's not yet clear whether the weather will create any delays, but they are working through that with FEMA and the state.
Okay, good. What sort of delays might what would happen that would make it harder for you to mobilize and be able to have your guys and women ready at those particular sites? Like, what would be some of the issues that might come up?
So, Congressman, I don't believe it would be the issues with our force. It would be issues surrounding the facility, access to the facility, and all the other supporting agencies. Our forces will move and be there in time. Over.
Okay. Well, no, thank you very much. That's very important to know, because obviously, as soon as we get past the storms, I know that people are going to really be anxious to get back and start receiving their vaccines again. So I appreciate your time and answering those questions. I yield back the balance of my time. Thank you.
Thank you, Mr. Vasey. Ms. McLean.
Thank you, Mr. Chairman. As we all know, China has become an ever-increasing threat, not only to the Pacific region, but globally. They've built up their armed forces to threaten our allies in the Pacific, use their Belt and Road initiatives to bring poorer nations under their thumb, and now released a viral epidemic upon the world. My question is for Major General Taliaferro, has our ability to deter aggressive actions by China related to the construction of the islands in the Pacific region, has it been reduced because of the necessity to protect our forces during this pandemic?
So, Congresswoman, I'd say absolutely has not been reduced. Our forces are very active in the Pacific, in that region, whether conducting freedom of navigation operations. We've deployed Bomber Task Force to the region and continue to project power into that area. And last spring, the combatant commands and the services worked very deliberately to ensure that we were able to operate within a COVID environment to perform our defense role. And certainly we've been active in the Pacific ever since.
Thank you. I yield back my time.
Thank you, Ms. McLean. Ms. Murphy. Ms. Murphy, you're up next.
Thank you. And thank you all for being here today and for your testimony. And also thank you to all the service members for what they do every day to keep our country safe. You know, I represent a district in Central Florida, and I had a chance to visit with some of the Florida National Guard that were deployed to DC, and also to have had some conversations with the Florida National Guard leadership. And I think a few things stand out to me. One, it's clear that the multiple deployments and the high op tempo has had an effect on morale and, you know, possibly on retention. As some of the previous questioners talked a bit about that, and I think it may be too early to have the data to say exactly what impact that will have. But I think that's something that we should watch for. But you know, we have to understand these are citizen soldiers who've been repeatedly called away from their families and their jobs and put in fairly stressful situations. And I think in Florida, this strain has been really amplified because despite having one of the largest states, we have a relatively smaller Guard. We are number 53 of 54 in Guardsmen to citizens ratio. And during a pandemic, it's not really feasible to borrow Guardsmen from other states as we would normally do in responding to a geographically focused natural disaster. And I think on top of this, For Florida, the pandemic has disproportionately impacted us because we have one of the highest percentages of more mature Americans as a part of our state population. And those are the Americans who are more vulnerable to the negative impacts of COVID and most in need of vaccinations, along with our frontline and essential workers. And then in the nature of being a superlative, we're also one of the states with one of the greatest incidents of natural disasters. So I look at all of this and I see a lot of risk here going into this coming year and into the summer when hurricane season starts for us. I'm really worried about the ability to respond to the requirements and then the impact on the men and women who serve in our Guard. So General Nordhaus, 2 questions for you. In the near term, as we look out on this year and Florida's natural disaster season, it's going to put additional operational pressures on our National Guard force. How is this going to be balanced with the increased vaccination pace this summer? And then in the long term, what efforts are underway to study the proportion of Guardsmen to citizens to ensure that we have sufficient forces to support the whole range of needs from disaster response to emerging challenges like COVID support?
Congresswoman, thank you for the question. On the first side, as we get to the summer, hopefully with the number of vaccinations that will be available by June and July, that we get really close to having all of our service members vaccinated, and that will help as we go into that season. Every year we do get together and we have workshops that bring all 54 together for domestic operations, and we look at the EMACS, Emergency Management Assistant Compacts between states to help assist in things like hurricanes that Florida might be undergoing from other states nearby. As you know, Florida has helped out in other states through hurricanes over the last couple years. As far as the force structure per civilian ratio within the state, Major General Eifert, the Adjutant General, will work that through the Army National Guard and the force structure committees to push that forward and then have any decisions through the service.
Well, as he does that, he has the support, my support for sure, for us to take another look at making sure that our Guard is appropriately scaled for the size of our state. Just pivoting to another question, a little unrelated. I know that DoD has been looking at the impact of right-wing extremist ideologies on the ability of DoD to carry out its duties. Has there been a similar effort within the Guard, and how have some of these early analysis come out?
Congresswoman, we fall right underneath the Secretary of Defense's new thing that he just pushed out. It's not tolerated across the National Guard or anywhere within our organization. It goes against our fundamental principle of the oath that we take, and so it can't be tolerated. And we're working through our services, both the Air National Guard and the Army National Guard, through the service programs that come down from the Secretary of Defense and the stand down within the next 60 days, and we'll implement those all going forward.
Thank you, and I yield back.
Thank you. Mr. Jackson, you're next.
Thank you, Chairman. Thank you, Ranking Member Rogers, and thank you to our witnesses who are here today. I want to start by telling the witnesses I appreciate your service to our country. Thank you for everything that you've done. And I just want to start by saying that, ever since COVID-19 has started, this pandemic has affected our military in a variety of ways. And I do believe that the response from the Department of Defense has not only saved countless civilian lives, but has also been really good in regards to ensuring that we've been safe all over the globe from threats elsewhere simultaneously. So thank you for everything you've done. I want to just state a few facts, and then I want to ask you a question that I've received on several occasions that I don't feel like I have a good answer for. And I'll just start by saying that I think with regards to DoD, the response to coronavirus began almost immediately. DoD provided approximately 200 beds at March Air Force Base for State Department officials who were evacuating from Asia. And Transcom worked to bring home nearly 4,000 U.S. citizens who were stranded overseas at the start of the pandemic. This incredible response continued as the hospital ship Comfort and the hospital ship Mercy provided humanitarian aid in New York and Los Angeles as cases begin to surge. Later, we faced critical shortfalls in PPE. DoD once again answered the call by providing over 2,000 ventilators, over 5 million N95 masks, and other critical PPE. And another well-known aspect that I'd like to ask about with regards to DoD was Operation Warp Speed. DoD played an absolute critical role in developing the COVID-19 response as it relates to Operation Warp Speed. These efforts continue. We continue with these types of efforts. President Biden has now released a 200-page national strategy for COVID-19 response and pandemic preparedness. However, I think this plan to me looks familiar to what I've seen prior to the Biden administration. The Biden plan aims to fill supply shortfalls by invoking the Defense Production Act, which we've talked about briefly here. And I believe that's something that President Trump had already done as well. The Biden plan says that the DoD will bring logistical expertise and staff to support the COVID-19 response, which I think is also something that President Trump was quick to do. The Biden plan says that DoD will support states' efforts to provide DoD resources and personnel. And once again, I believe that's something that I've heard the president say early on that was enacted quickly by President Trump as well. President Biden has rolled out his groundbreaking plan. He rolled this out on his first full day in office. But with reference to DoD, once again, it sounded to me like the President Biden's plan was building on a lot of the great work that happened during the Trump administration. I think that good work should be acknowledged. I think it's become clear that President Trump and his administration responded effectively and decisively in the face of this pandemic. And I'm glad to see the Biden administration, in my mind, is building upon the successes of the Trump administration with regards to DoD's approach to this. The question I have for you is, I would like to ask each of you, and we can start with Mr. Salas, if you'd like. I'd like to know, with regards to DoD, how are the operations in the Department of Defense? How have they shifted under the Biden administration? And could you outline what actions are now being taken that were not being taken before, specifically with regards to DoD under the Trump administration? Thank you.
Congressman, thank you for the question. The department obviously has a long history of supporting civil authorities. We continue to do that. A number of the initiatives under President Biden, to include the initiative to establish the mega and large vaccine centers to make sure that we're out. The department, as we've already discussed today, there's community-based support that's being provided by the Guard, but the new mega and large centers will produce a lot of vaccine shots at the community level. We've also got initiatives underway with the new administration to make sure that all the mitigation measures, the mask wearing, the workforce protections, and those types of activities are being implemented effectively.
Thank you, sir. I don't know if any of the other witnesses have anything to add to that. If not, I'll close up here. Well, I'll close then. I'll just say, I do want to thank you all for what you've done. I do think that the Department of Defense has done an outstanding job in supporting the COVID efforts across the country since the very beginning of this. I have full confidence that we will continue to do an outstanding job for our country and take care of us all. I appreciate everything you've done. And with that, Mr. Chairman, I yield back.
Thank you, Mr. Jackson. Mr. Moore.
Thank you, Chairman. Many of the questions I had were related to training, and it's largely been addressed. So I will just briefly say thank you to the Department of Defense. Yesterday I had the opportunity to do an immersion tour in my district at Hill Air Force Base. COVID-19 response was their top item that they briefed me on, and just had an incredible experience seeing the breadth of what goes on there. As we explored and discussed the COVID-19 response and where things are at now, I'll just say that I'm hopeful that we can have a really strong focus on getting back to training and making sure that we make up for lost time that was required during the pandemic to build on that. It's a crucial part. It helps with morale and so many different factors, especially interacting with our foreign partners as well. And so that's the piece that I would just want to highlight, but also just comment on, how well they responded. Our depot work, they were essential workers. They powered through and they kept operations going. I know that wasn't the case everywhere and been able to do it, but I was just really proud of Hill Air Force Base for being able to do it, and across the department did an exceptional job at handling COVID. So thank you for all your good work, and to the committee. With that, I'll yield back.
Thank you, Mr. Moore. Mr. Fallon, your turn.
Thank you, Mr. Chairman. When we get down to this level, all the good questions have been asked and answered. I want to thank the witnesses for their testimony. I do have to say and echo what Admiral Jackson said, Ronnie Jackson said, what I really do believe the legacy of the Trump administration, their finest hour will be warp speed. I think this will get us through this pandemic and be stronger as a nation because of it. And sometimes you just have to give credit where credit's due, regardless of whether or not you agree or disagree with certain administration's policy. I think President Trump's administration did a fantastic job. I do have one quick question, and it was touched upon, but I just want to get a more specific answer. How is the curtailment and or the cancellations of some of the exercises that we would have had with our foreign powers and allies, or our foreign partners and friends, rather, have affected our efforts to strengthen the alliances and build our readiness, both between and really our efficacy and synergy with our allies? And I just wanted to ask the witnesses how the pandemic has affected this.
Thanks, Congressman. It's General Tolliver. In the overseas exercises, the Joint Force Exercise Program, we talked about the exercises that have been canceled or delayed. And in those opportunities, those training opportunities, we can further develop our partners, we can facilitate interoperability, and we can grow and strengthen relationships with our partners that, as we mentioned, have a wide variety of advantages. So we need to stay engaged with our partners going forward and strengthen those relationships through a variety of mechanisms.
Congressman, this is Bob.
Thank you.
Bob Salas. I'd just like to point out, although the physical engagement with our partners has been limited, a lot of activity continues with our international partners through our combatant commands, through the OSD staff, with the allies and partners on a daily basis. So that contact is always there, working together in that regard. So that is still a very strong commitment from one another.
And Congressman Major General Nordhaus, I'd also like to comment the State Partnership Program, which has our 54 states partnered up with other nations throughout the last year. Those nations have reached out to state to country and talked COVID and learned from each other. So that's been very productive as well.
And would it be fair to say once we have our troops vaccinated, it looks like from testimony that would be around July, that come the fall, we're going to be back up to pre-COVID levels as far as training, and will this largely be in the rearview mirror, in your professional opinion?
Congressman, it's General Tolliver. I'd say certainly here in the United States, the services have already adapted and have returned to large training venues. Right now today, there's 3,000 Marines training together down at 29 Palms. Large force exercises and training is happening in the United States. Our overseas exercises frequently are dependent on the participation of our partners and whether they're able to attend, whether they're able to participate. But even in opportunities where they're not, our forces will continue to train and take advantage best we can of those opportunities.
Thank you, Mr. Chairman. I yield back.
Thank you. There are, as I understand it, no further requests for time. I know we, and also we